So, exercise is great, right? But what if every time you exercise, you get a really, really bad headache? I once saw a lady in clinic who had this problem. She got a horrible headache every time she would exert herself, and I was very concerned. I ordered some tests, and when I saw her a few weeks later, a massive problem had already come to the surface. It was life-threatening. By watching this video, it's possible that you could save a life. So, let's dive in. Hey everybody, I am Dr. Parker Bohm. I am a neurologist with a subspecialty in neuro-ophthalmology, and my mission is to bring you high-quality educational content. So I recently had somebody comment on one of my other videos that she had developed headaches that seemed to worsen with exertion. And when I read that comment, it reminded me of a patient that I've seen that I really want to share with you because I think it could make a big difference for some people. You won't want to miss this scary and sneaky problem that was causing her headache. She was in her mid-50s and pretty healthy overall. I think she had a history of high blood pressure when I saw her. And she came to me in neurology clinic because she had developed several months of this exertional headache. So anytime she would exercise or exert herself, she would start to get this pounding headache kind of throughout her whole head. Now this was a new type of headache. She did have a history of migraines when she was younger, but she said her migraines were nothing like this. And that's an important clue. When she got these headaches, they would get really intense to the point where she had to stop what she was doing. So if she was going on a brisk walk, she really had to stop walking and rest, and then the headache would subside. Now, importantly, with her headache, she did not have any other neurologic symptoms. And what I mean by that, she did not have any slurred speech, or weakness on one side, or balance problems, or double vision. And the headaches weren't waking her up from sleep in the middle of the night. So the reason I ask about some of those things are, those are trying to ask about what we call red flags in the headache history. Things we hear to make us think as neurologists, this is not good. This could be due to something serious. But she didn't have anything like that. Something else important to know is she did not have any sort of chest pain. She did not have shortness of breath when she would exert herself. She did not have jaw pain or anything like that. So that's important to know because some of those symptoms can be concerning for coronary artery disease or when there are blockages in the heart leading to a lot of different symptoms. So when I saw her, I let her know that the fact that she had a new type of headache in her 50s that was present with exercise or exertion was potentially something very, very serious or very, very scary. So I did let her know about that because I wanted to communicate with her the potential risks of having a problem like that, so that way she would know to take it seriously. So in her case, I recommended that we start by getting an MRI scan, so basically a very high quality, high definition picture of the brain, and then also get what's called an MR angiogram of the head and neck at the same time. So it's like the MRI, but it's basically zooming in on the arteries going up to the brain to make sure that they look okay. And that would also look for things like an aneurysm, for instance, in the brain. So the plan was that I ordered the test and we would let her know as soon as we got the test results. So several weeks later, I see her name on my schedule. And I realized that I had never got the results of the tests that I ordered. So I was looking in the chart, making sure I didn't miss something. And at this point, I was really frustrated because I hate seeing patients back when I have not been sent the results of the test I ordered, because I feel really bad for the patient, because oftentimes they're coming into clinic saying, okay, what did it show? And I don't have the results. So the patient's frustrated. I'm frustrated. It's just not a good situation to be in. So I walk in the room and say, hey, I'm so sorry. I actually never had the scans sent to me. And she said, that's okay. I actually never got them done. I had something really serious come up. But the good news is my headaches went away, which was amazing to hear. But I was also super confused. So I'm like, well, hey, I'm glad your headaches went away, but what happened? So she goes on to tell me that in between that first visit just a few weeks ago, and now she had passed out at home, was unconscious. 911 was called. She was taken to the hospital. She was found to have major blockages in her coronary arteries, and she had to have triple bypass open heart surgery because she had such bad coronary artery disease. And after the surgery, she said that she no longer had her headaches that would come on with exercise or exertion. So at that moment, I instantly put 2 and 2 together that she had something called cardiac cephalgia, or cardiac cephalgia, the other name for it. And she had not made the connection yet. So she actually had a pretty rare problem where major blockages in the heart were presenting with just isolated severe headache that would come on with exercise or exertion. So, weirdly enough for her, major problems in the heart were not causing chest pain, were not causing shortness of breath, were not causing jaw pain, were not causing nausea, were not causing pain in the left arm. It was causing an isolated headache. Thank the Lord she was okay. And real quick, I do want to thank you for watching this video. Your time is very valuable, and the fact that you're spending it watching this video is really amazing, so thank you. It really does help out the channel a lot if you could drop a like or subscribe if you like this kind of content. But again, thanks for watching this video. If the MRI and the MRA that I ordered had been negative, I was definitely going to refer her to a cardiologist or for a stress test or something to try to figure out if her heart was playing a role, because I knew about this cardiac cephalgia, or headaches due to coronary artery disease, but I also knew that that was super rare. So I did my residency training at the Mayo Clinic in Florida, and one of the headache specialists had shared with me during my training that he had just had a couple of cases throughout his career after practicing headache neurology for a long time, where somebody was having headaches due to coronary artery disease causing just isolated headaches. So I knew it was a thing, but at the same time I knew that was very rare, which is why I went for the MRI and the MRA to look into all of these other potential causes. But obviously, looking back, I wish that I would have gone straight to the heart as a possibility in her case. So we don't really know why some people, when they have blockages in the heart, the coronary arteries, causing coronary artery disease, get isolated headaches. So potentially it's due to what we call referred pain, which is where you feel pain somewhere else rather than where the actual location of the pain is itself, just because the nerve endings aren't very precise in terms of maybe somebody has a gallbladder issue, so they're having pain down here, but they could also feel that pain in their back. That's a potential cause or a potential example of referred pain. So maybe some people for some reason get referred pain to where they're getting a headache instead of pain down here. Or maybe it's that when there is ischemia, so lack of oxygen, lack of blood flow getting to the heart and some of the blood vessels secrete or release some certain hormones or molecules that cause dilation of some of the blood vessels, and that is what is causing headache. It's kind of unclear what is actually causing the headache in this cardiac cephalgia. The other weird thing is, why would it cause an isolated headache and none of the other classic cardiac symptoms? But to be honest, medicine, the practice of medicine, is just confusing, and there's a lot we don't know. So cardiac cephalgia was first described back in 1997. Yes, I was only 7 years old at that time, but there were 2 cases reported of people that developed severe headache throughout their entire head between 5 and 15 minutes after starting some sort of exertion or exercise. In both patients, the pain reached a 10 out of 10 level on the pain scale, 1 to 10, so super severe pain. And in both of those patients, after their coronary artery disease was treated and taken care of, their headaches completely went away. So there's a really nice review of this cardiac cephalgia in the journal Practical Neurology, which is an excellent journal in my opinion. And it has this list of red flag symptoms, and I'll put that up on the screen. So potential symptoms that you could see in people who have this cardiac cephalgia or cephalgia. So headache brought on with exertion, coughing, or sexual activity, new or different headache, age greater than 50, and of course vascular risk factors like current or past tobacco use, high blood pressure, high cholesterol, diabetes, family history of heart disease, things like that. Now let's say you have a headache that is brought on by exercise or brought on by exertion, but you've already talked to your healthcare provider. He or she has done all the appropriate tests to try to rule out big, bad, scary things as a potential cause. Where do you go from there? What do you do next? Well, I do want to tell you about something. I actually talked about it earlier briefly, but it's called primary exercise headache. Primary exercise headache can cause all the symptoms that we've been talking about, but it is due to a benign type of cause, meaning even though the symptoms are very scary, it is not a life-threatening issue. This is what we call a primary headache disorder, meaning this is a problem with how the brain is acting, how the brain is perceiving signals, just kind of like migraine is a primary headache disorder, meaning it's not due to a tumor, it's not due to a blood clot, it's not due to an aneurysm. Migraine is the problem. Well, same type thing with this primary exercise headache. So primary exercise headache typically lasts for a few months and then oftentimes will go away on its own. For unclear reasons, it tends to cause headache that is worse with exertion or exercise more in the heat or at high altitudes. Oftentimes patients will kind of have a headache throughout their entire head. And it's really thought to be pretty uncommon in general. The headaches typically last less than 48 hours. And again, most patients, by the time they've had this for 6 months or so, it'll oftentimes go away on its own. Now, in terms of treatment, once you've ruled out big, bad, scary things like we've already talked about, the treatment kind of depends on how bad the symptoms are. So yeah, you can tell the patient, hey, just try to avoid that type of activity. But if walking is bringing on the headache, that's not very good for quality of life and not very practical to tell the patient, hey, just don't walk anymore. So there are a couple different treatments you can try. One of the treatments is something called Indomethacin. Indomethacin is what we call an NSAID or a non-steroidal anti-inflammatory drug. So think like ibuprofen, something like that, naproxen. I oftentimes explain it as a very strong type of NSAID, and while it can be very, very effective for certain types of headaches, it does have some potential risks. It can actually cause stomach ulcers, GI bleeding rarely, so those are always things that we talk to patients about, have a big conversation about. It can harm the kidneys, so we always recommend that people stay very, very hydrated if we're going to use a medication like Indomethacin. But there's also some other options, so certain beta blockers, for instance, one called Propranolol, a medication I use a lot. So at some point I will make a video about Propranolol and link it at the end. Propranolol is something that lowers the heart rate, lowers the blood pressure, and it can be very helpful for treating these type of headaches. Finally, I do want to mention that a lot of people with chronic headaches will just notice that their normal chronic headaches do get worse with exertion. And I think that makes sense. If you have bad chronic migraines and you're in the midst of a bad migraine and all you want to do is lie down and try to go to sleep and not move, well, it's to be expected that if you get up and exert yourself or exercise, that headache is going to be worse. So just because a headache worsens with exercise or exertion, it doesn't necessarily mean it's an exertional or exercise headache. We're talking about headaches that really are brought on specifically by that activity, not when you have a headache and then that activity makes it worse. So in summary, a bad headache that comes on with exercise or exertion can certainly be due to a very scary and potentially even fatal underlying problem. So we generally do a workup to look for some of these other problems. However, Oftentimes the workup is negative and we have ruled things out, and we may label it as a more benign condition like primary exercise headache, and then talk with the patient who has it, with the person experiencing the problem, to figure out, is it bad enough to treat this symptomatically or to go on medications to help out with the symptoms. So thanks to you who have stayed watching to this point. It really is an honor that you're taking your time to watch my video. I'll link to some other videos that you can check out, including a link to a sneaky and increasing neuro problem that can cause headaches and potentially blindness, specifically in young, overweight women. And this disease that this video is about is on the rise, so you can check that video out. And I'll leave you with one last thing. How are you going to make the world better this week? It's something I need to think about too. So we'll catch you guys later. Thanks again. Peace.